prepares to move to a different location. Good afternoon. We continue here. Clinical infectious diseases epidemiologist Professor Salim Abdul Karim has warned that South Africa should be vigilant and be ready to respond to the Ebola outbreak. His warning comes as a new outbreak is currently spreading in Central and East Africa. Professor Salim Abdul Karim joins us now live for more on this. Thank you very much for your time, Prof. Ebola hit Africa for the first time in 2014. What about it this time around is concerning for you?
Yes, we are dealing with a different situation. It's the same disease and presents clinically just as Ebola did in 2014 when we dealt with a pandemic level Ebola situation. This time around, the particular virus or the strain of the Ebola virus that is spreading is different. So previously in 2014, it was the Zairian strain. This one is called the Bundi-Bujo strain. We've known about it for just over 2 decades, but it hasn't really led to any significant outbreaks before. There have been 1 or 2 small outbreaks, but this time around, it started spreading, we think, somewhere around 2 months ago, and has now reached a level where we've got over 500 cases, more than about 130 deaths. So the situation has escalated quite quickly. And the big problem with the difference in the strain is that our regular and usual tests that we use to detect Ebola, those tests don't work against this new strain. The Bundi-Bujo strain is not picked up by our routine tests. There's also no treatment for the strain. There's no vaccine for the strain. So in a way, we are sort of dealing with a virus for which we have no biomedical tools to help in controlling it.
Yeah, and this then would speak to South Africa's preparation, right, and screening capabilities at ports of entry. South Africa is not only a receiving country in terms of migration, but there's also movement to other countries, some of whom have active cases of the strain.
We've seen already by last weekend, there were imported cases of this new Bundi-Bujo strain of Ebola in Uganda. There was already a death in Kampala, and there were other imported cases. So we will expect, based on what we've seen in 2014, we can expect that there will be imported cases in multiple countries, because the DRC is not an isolated, not an island. It's connected to many other countries, and we would expect, particularly the porous borders with South Sudan, Burundi, and in the south with Rwanda, we will expect to see imported cases there. But even distant places, we will expect people from the DRC who are flying out, carry that risk. So the whole world has to be vigilant, and this is not it doesn't help to close a border, because we've seen from past experience that doesn't really work. All it does is that it drives the cases underground. What we need is transparency. We need people to come forward if they get sick. We need people to subject themselves to screening measures. And if we are vigilant, we should not really have a problem.
Yeah, the COVID pandemic taught us a thing or two about screening capabilities, and one wonders whether or not South Africa is prepared, at least in this regard, given how this strain is moving and how fast it's now spreading.
So I think, the whole world needs to be on a, readiness footing, and the WHO declared a public health emergency of international concern last weekend. The Africa CDC declared a public health emergency of continental security on Monday. So what we are seeing is the message is out there. Get ready. From the South African point of view, I mean, we are very fortunate to have a really superb National Institute of Communicable Diseases, which is ably led by newly appointed Dr. Nazir Ismail. They have superb capabilities. They have the laboratory capabilities. They have the ability to identify patients, to do the sequencing. So in many ways, we are quite well prepared. If you just go back to the hantavirus outbreak, it was South African laboratory that identified that this was a hantavirus outbreak. So we are in many ways better prepared than most.
Yeah, and when you talk about preparation, one then wonders whether or not from a medical point of view, treatment point of view, we are prepared, because you're talking to us about a strain now that does not have any form of treatment.
Yeah, so what it needs is the following. It needs all travelers to be monitored, and self-monitoring usually works quite well. If any of them becomes ill, they go to a healthcare facility or call in the local health authority and tell them that they're ill, and mostly we're worried about fever. That will be the number one presenting feature in most of these patients. And the moment that happens, most of our hospitals are well geared up to deal with this, in that they know all of the procedures about how to admit a patient, minimizing exposure to others. And that includes ensuring that all of the staff that are involved have the necessary PPE, protective equipment. This is not, it's not something we haven't done before. I mean, when I think back, I was a young doctor in virology in the 1980s, and I used to run the hemorrhagic fever ward at King Edward VIII Hospital, and we had 2 cases of Congo fever. We knew exactly how to deal with it. We didn't expose anyone else. So I'm not concerned from that point of view. What, for me, is important is that we need to ensure that we are doing what we can to help the DRC so that it's contained at source. We don't want to be dealing with it in multiple countries. We want to try and contain it there. And it can be contained if we use well and truly tried public health measures. And that is, identify every case, make sure they're isolated, ensure you do contact tracing, that they are isolated. So if you do that, you can contain, because this is not a highly infectious virus. This is not COVID. It doesn't spread through coughing and speaking and so on like COVID did. This virus is much less infectious. You spread it by direct contact with the patient's blood or saliva or any of their secretions. So we're dealing with a very different situation. So we mustn't, think about it in relation to COVID-19.
Yeah, and of course, how do we intervene in the DRC, Prof? Do we send personnel there to assist them in contact tracing and containment?
Yeah, in many ways, we have very good expertise in South Africa in contact tracing. It comes from our years of dealing with tuberculosis, where contact tracing is a key element. So what can we do to help the DRC? I'm just waiting to hear. I'm supposed to be been asked to go to the DRC next week, so I'll be able to get a better sense when I'm on the ground. But to me, the elements that are important is that we, for example, at the NICD, we have a laboratory in a box. We can go with a whole lot of boxes, set up a laboratory to test for Ebola. We did that during the 2014 outbreak. Professor Poeska took the mobile laboratory in a plane to Côte d'Ivoire, set it up, and was doing PCR testing for Ebola. So we can do that. Now, at this point, we don't have a test that we can use, but I'm anticipating that once that test arrives, then this kind of mobile laboratory will become important. But we need, we're likely going to be needing, at this point, principally we need resources, and that's principally money. We're going to need vehicles to get blood specimens from the different doctors and hospitals in Ituri province all the way to Kinshasa. That's a 600-kilometer journey by road. So, the logistics of what that involves is enormous at this point. So I would say resources and possibly human power with time.
Yeah, you are calling for South Africans to remain calm and to obviously follow science-based advice. But also, one may say, we saw during the COVID pandemic how there was also somewhat of a pushback when it comes to that science-based advice on people taking, for example, the vaccines that had become readily available. How do we then encourage South Africans to then come back and follow the science-based advice?
Yeah, there will always be conspiracy theories. It's in the nature of, any calamity. There will be those who will focus and distract by punting stories that have no basis in truth. I think for the majority of people, what we want to do is, if you receive a message and you're not sure about its verified source and you're not sure about its accuracy, don't share it with others, because that's what conspiracy theorists depend on. People just blindly sharing information without thinking about it. So we need to ensure that when we get information on Ebola, we need to ensure that this comes from a reliable source and it can be verified before sharing it around. But at this stage, we don't have a vaccine for this particular strain. We don't have a treatment. So what's important for us is not to be overly concerned about that, but rather to be concerned about the need to go quickly into research. And right now, the discussions have already started. We will likely have 2 candidate vaccines ready to go in the field within the next few weeks if supplies are available. So there's a lot of movement now to try and ensure that, we're not sitting with a situation 6 months from now where the virus is spreading and we didn't start doing these trials of new treatments and new vaccines. And so when we met as the emergency consultative group on Monday, that comprises 20 of Africa's leading infectious diseases researchers, that group was very clear about the importance of that research, and we got excellent feedback from the Africa CDC about candidates that are ready to go into clinical trials. So from my point of view, follow the science, be calm. There's no need for any particular action at this stage. We are in good hands with people who know what they're doing to help us control this epidemic, and we must be ready to support others in trying to control it.
Professor Salim Abdul Karim, thank you very much for your time this afternoon. He is the director at the Center for AIDS Program of Research in SA and chair of the Africa CDC Emergency Consultative Group. All right, 2 lawyers.